Welcome to the Fire Rescue Wellness Podcast Spotlight, where we revisit take-home messages and shine a light on previous FRW podcasts in 10 minutes or less. I'm Lex, AZ's right and left-hand woman, and I churn out these mini episodes for her. Let's go.
So one of the things that's important is to recognize what someone's baseline behavior is versus what the behavior looks like after they've suffered some type of suspicious impact. So if you know someone is like fairly athletic, they usually don't have difficulty with their balance, they're not used to seeing them stumble, and let's just say that they're out and something kind of looked like it grazed their head, or you're working with a patient that's, can get a little bit violent and they might have taken a headbutt to the head. Like, it might not seem like a big deal, but if you see the person and they're stumbling a little bit, if you notice that their gait is a little bit wider or that they're freezing with different parts of their gait pattern, then these are some of the first signs that can show up when someone may have some signs of concussion. Another thing to kind of look out for is if someone actually takes a blow to the head and they actually go into something called a fencer's response, where their head starts to turn, their arm starts to go limp, and they start to fall over. Even if they don't lose consciousness, that's actually a clear-cut sign that they've suffered some type of brain injury. So noticing some of these signs can help you identify that, okay, this person likely suffered a concussion. And instead of letting them kind of push through work, we need to kind of separate them from the work and say, hey, I think, you probably took a concussion. We're going to probably just let you rest here for a bit. We'll probably call it a day on work-related activities. And then that person will typically, if you suspect a concussion, will need somewhere between 36 to 48 hours of just, rest time to help their brain recover, and then get them started to, basic movement and start to get them back to normal activity again afterwards. And then, follow that up with seeing a doctor or a concussion specialist to see what level of brain injury did they have and what things would they need to focus on in order to rehabilitate it, because a lot of the evidence suggests that early treatment for some of these head injuries lead to better outcomes.
And I'm gonna go out on a limb here, and by all means correct me if this isn't accurate, but I would assume that much like an athlete, a firefighter that experiences a concussion would also have the danger of the second impact syndrome and would need to be rehabilitated in the same fashion for successful quote unquote return to play. Is that accurate?
Yeah, that's accurate. The biggest thing is, what's the likelihood of getting that second head injury? If you're playing a sport like football, the likelihood of taking a second head injury is really high, right? Whereas other sports, they might be a little bit lower because head contact isn't that common. So it also depends on the nature of your work. And, when we talk about second impact injury, like understanding the physiology of a concussion can be important. So when you have a concussion, you have all of these neurons that start to fire heavily inside of the head. And whenever neurons are firing heavily, they need a lot of energy in order to fuel that level of activity. But a lot of people, when they have a concussion, is they will go through vasoconstriction in some of the arteries that go up into the brain. So you have this energy mismatch where your neurons are firing very heavily, but then the blood flow isn't getting glucose and oxygen up to the brain in time. So you're running at this energy deficit, and that's what's driving a lot of this concussion physiology. While the patient is in that concussion physiology, they may become asymptomatic, they may feel okay, but as long as that energy mismatch problem is there, they become susceptible to an additional impact, which can really catastrophically worsen that issue. And that's where you could have more permanent injuries to different neuron populations in the brain that could cause permanent damage.
You just explained something so clearly that I have never understood. Thank you very much. That makes a lot of sense. So let's transition to, obviously, we would like to recognize early recognition of concussions and aggressive treatment. But let's go for a second to any further complications of untreated concussion. So as an example, As a probationary firefighter, I took a spill off of a ladder in a training tower. I fell maybe, I don't know, 4 or 5 feet and hit my head on the concrete training tower floor and shook it off because I'm in academy. I have to shake it off. But are there any complications from A, not recognizing that, and B, not treating that potential concussion?
So the good thing about it is that for many concussions, there can be a natural recovery without any lasting injury. So that's the good news about a large percentage of concussions. And a lot of it also depends on your baseline fitness. So if you're someone that has a fairly high level of baseline fitness, your brain is generally going to be more resilient. Or if you're someone that's a little bit more sedentary, then your brain is going to be a little bit less resilient. There are observational studies that show that some patients with concussions will develop, higher risk of psychiatric issues like depression and anxiety and things along those lines. And in some like really aggressive contact sports that have multiple head injuries throughout the course of their career, that's where people start to develop a little bit of worry about things like chronic traumatic encephalopathy and other neurodegenerative diseases as potential downstream risks. But those are typically isolated more towards people that are in contact sports and not necessarily someone that suffered a concussion and then recovered and then didn't have any other issues with that. So I would say if it's a one-off concussion, you can be reassured that most people can and do recover fairly well, especially with good rehab. But it's really like the repetitive contact, the repeated concussions that can be more of a long-term threat to someone's brain health.
Gotcha. And I just want to I want to underline in dark red marker what he said. The more fit you are at baseline, the better your potential outcome. So here's yet another reason to take really good care of that body that carries your brain around.